So good afternoon, everyone. Hope you're all well. My name is Lorraine York-Edberg, and I'm the SHINE Regional Director for the SHINE program in this service area, which is Hadley. We're at the Hadley Council on Aging, and I do have with me our SHINE program counselor, and her name is Jane Sullivan, and she's here as well. We're here to talk to you today about the SHINE program, some general information, and really information about the enrollment for Medicare annual open enrollment for prescription drug plans and Medicare Advantage plans. So I have handed out a yellow sheet of paper, and this has information about what I'll be reviewing today. And I handed out another piece of information, a pink piece, and that goes over some of the special programs that are available to people in Massachusetts. So I just want to tell you about those in a few minutes. But first off, I just want to ask everyone a few questions so I know why you're here today. Does everybody here have Medicare?
Yes.
Okay. And how about a prescription drug plan through either a Medicare Advantage plan, like an HMO, or a PPO, or a standalone drug plan?
Well, we're still on my employer's plan, but we have Medicare Part B.
Okay, so you're still on your employer plan, but you're gonna be moving off from that plan?
She is.
She is. Okay, very good.
Same thing with my husband.
Same thing with your husband. So we're gonna be talking a little bit about when people get enrolled into Medicare, and maybe that will help as well. But I'll start with the Medicare open enrollment period because that's what's happening right now. So every year in the month of September and in October, people will receive information from their current Medicare prescription drug plan, either through a standalone drug plan or through a Medicare Advantage plan like an HMO. In this service area, we've got Health New England HMOs. We also have in this area the Blue Cross Blue Shield HMOs and PPOs, and those have the drug plans embedded right in them. So they have health insurance plus drug coverage. And then we have 20 standalone drug plans, and next year there's going to be 21. All of these plans are required to send information to their members about the changes that are going to be coming in the coming year in 2018. And those changes could include things like medications taken off their formulary, which is a list of their drugs that are currently covered by their plan. Also things like prior authorization, so there's restrictions that can change. So you want to make sure whatever plan you have that you're really looking at the details, making sure that the drug plan you have, you're okay with the premium, that it still covers your pharmacy that you're using, that it still has all the medications that you are taking on their formulary, and that the cost of these medications is acceptable to you. Because sometimes there are plans that might have lower costing medications, and it might be to your benefit to go with that plan. Now the SHINE program, we have about 45 counselors in our service area. My program covers 54 towns, which include all of Franklin County, most of Hampshire County, parts of Hampden County, and parts of Worcester County. So in that area, we have counselors that meet one-on-one at the senior centers, at community health centers, and they can help you, also at hospitals. They can help you with these kinds of issues where you want to review your information to make sure that the plan that you're going to be in for the next year is still right for you. I like to call this time of year the annual health insurance checkup. So it's a checkup to make sure that the insurance that you're currently in is still good for you in the following year. And I think it's really important to do this. Every time I don't meet with somebody one year and then I meet with them the following year, we always end up saving them a lot of money. But it also means that probably they weren't in the right plan the previous year. So that can be very difficult for people to come and see us, but it really is important. We also can do these kinds of things over the phone. So we have a regional office in Greenfield at Lifepath. We're located at 101 Munson Street, and Lifepath is the program, the Area Agency on Aging or Aging Service Access Point that is housing the SHINE program. And we also have other programs through LifePath in Hampshire County. We have the Adult Family Care Program, which is a special program where you have host families assisting with, as caregivers for maybe an older adult or a younger adult that is disabled. And they take care of them and they get a stipend from the state. And it's a great program. There's also the PCA program, which we have out in this service area, which stands for Personal Care Attendant Program. So if those are any programs that you're interested in, I have brought some materials on that as well. Yes?
Can you tell me just for my work up here, when, for instance, yesterday I got a call from a woman whose PCA isn't showing up, and I called our area agency on aging, and they said they had a hard time with all their contractors filling that need. So would you have the same contractors, or would it behoove me to also check in with LifePath if you're serving this area too? Because they're our area agency on aging.
Right, well, the PCA program is a special Medicaid program. It's for people
Okay.
that have special challenges.
Okay.
Sometimes people confuse the personal care attendant program with homemakers they
Okay.
get through Highland Valley.
Got it.
The personal care attendant program is a little bit separate
Different.
from that.
Great.
And it's for people that have chronic disabilities and the state's Medicaid.
Okay.
And they hire and fire their own people that work with them.
Okay.
But it is a great program, and it seems like you might have to talk to Highland Valley about that
Yeah,
specific
okay,
issue.
great, thank you.
Okay. Other questions about that? Okay. All right, so we're gonna move on to some more things that are important about these kinds of plans that you might have. So a person, when they get original Medicare, they're turning 65, or they could be retiring from their position, or a person simply is turning 65, was covered by their spouse's employee, and they don't want to be on that employer plan anymore. So they could stay on the employer plan, and they could defer their Medicare Part B and not take it. Medicare Part B this year costs about $134, and it hasn't been released what it's going to be for the coming year. But that gets taken out of your Social Security check, and if you're not receiving Social Security, then they bill you quarterly for that amount. But the point is that if you're working, you're actively employed, and you're covered by an active employed insurance, and your spouse is also covered by that insurance, you don't need to take Medicare at that time. You can defer your Medicare Part B until you are retiring or until you want the person to get off the plan. But for the most benefit, employer plans are really set up in a way that they benefit the employee. So most people don't want to, but they're always interested in looking, because the cost sometimes of these active employer plans can be fairly expensive. But for the most part, you know, employer plans are better. They have no limit on the medication costs for medications, and these Medicare prescription drug plans do have a limit. I mean, it's a large limit, but there still is a limit. So a person can choose, if they're actively employed and their spouse is on their plan, whether to pick up Medicare Part B or defer it, or pick up Part D or defer it. And there'd be no penalty if you deferred it because you had active employment with full health insurance coverage that included prescription drugs.
But you have to prove that when you enroll if it's after 65, correct?
Yes, and the way that is proved is that basically Social Security, you contact them and tell them that you're interested in enrolling in Part B now, and they'll send paperwork to you for you to fill out and request the month that you want your Part B to start, and then they'll send you information that you'll bring to your employer. They can send it to your employer, but I highly recommend that they send it to the individual. The individual goes to the employer, has them fill out the paperwork. They send them both back together to the Holyoke Social Security office and get it started that way.
Okay.
Because sometimes if they get
Get
separated and they could get lost, and
I just
you don't want to
sent
have
a
any
lady
gap in
the other day,
coverage.
because I pulled up that form to bring to the employer.
Mhm.
I gave her the application for the Medicare, and because she was still working, but she has to get off the insurance now. and also the form to bring to her employer. And she didn't want to go to Holyoke, but so I suggested she send both of those forms certified mail
That's a very good idea.
to Social Security.
Yep, so Jane was just saying that you can download these forms right from from online. You could do them on your computer, you could do a Google search, or is that how you got them?
Yeah, I Googled the forms, yeah.
socialsecurity.gov.
Remember, we printed those the other day.
And you can call Social Security at their 800 number, and their number is 1-800-772-1213. And when you get them, it's nice to just say agent, and then you'll get to speak to somebody quicker. So, because they are very automated and it's not as helpful.
And it's
But
probably best to call early in the morning.
Or later in the day, and not earlier in the month, because early in the month they're very busy. Also, we have some phone numbers and information about other important programs that are in our service area that I'll leave for you. Yes, sir.
So on that, getting the paperwork from Social Security for that, now, is that, I'm gonna stay on my employer's, but she's gonna probably come off, so I still have to do that paperwork for her?
Yes, you do.
Okay.
Well, is she just turning 65 now?
Oh, then
No.
you,
Oh, okay.
No, she,
66,
okay.
okay.
Yeah, the whole idea around sending the information to Social Security is usually because you have a special enrollment period, and it allows you 8 months to pick up Medicare Part B once
Okay.
you leave your employer plan.
oh, okay.
People don't want to wait that long,
Yeah.
but in the case of somebody turning 65 and becoming eligible for Medicare, that's called an initial enrollment period. And during the initial enrollment period, you have the 3 months prior to your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. That's why Jane asked, because she thought if you were turning 65, then you're in your initial enrollment period. Thank you, Jane. It was a very good point to bring up.
Okay.
And so that can be, not too complicated, but you would have to have the employer complete the form. And that is really to protect her from a penalty. Because every year, every full 12 months that passes, if you didn't pick up Part B when you were eligible for it, either through loss of active employer coverage or through you're initially turning 65, a penalty would start, and it would be a 10% penalty based on the current amount of the Part B. And it would be for a lifetime, and it would go up every year, and it'd be added to your monthly premium. So this year it's $134. Say you missed it for a year and you signed up for it during the general enrollment period, which is between January 1st and March 31st, then your coverage would start in July, but you'd also have a penalty of 10% if only one 12-month period went by during that time. And it would be 10% of the current Part B premium, which is $134, so that would be $13.40 added on to the $134. And next year, if the Part B went up to $150, your same penalty that was $13.40 this year is going to be $15 next year, because it's based on the current Part B premium of that year, and it's lifetime. So that's pretty much going to go up and up and up. We haven't seen a decrease ever. We've seen it stay the same, but never a decrease in the Part B premium that people pay for Part B.
But during open enrollment, this is the time to do it, change her over.
Exactly.
Okay.
Well,
No,
No.
I'm sorry, I apologize. So your question is, when is the time to change her over?
Yeah.
If you can change her over at any time, it doesn't really matter. You make that decision and then have the paperwork sent out. If she's over 65, then the paperwork would just reflect the information about when
Okay.
her plan is ending. But you'd want to start the Part B, coordinate it right with that ending of that employment, so she would have no gap in coverage.
Right.
And then you would meet with a Shine counselor, or you would make a decision about how you want to get your additional insurance. Because when somebody has Medicare, they have Medicare A, that's free, it doesn't cost anything, as long as you worked 10 years in the Social Security system, or 40 quarters.
Yeah.
And then Part B is going to be $134, Part B, what that covers is outpatient services. And there's some gaps with A and B. So A has a gap of $1,316 if you go into the hospital. So you'd be responsible for that $1,316 if you were hospitalized. Also under Part A is skilled nursing facility coverage. And with that coverage, the first 20 days are free under Medicare, but day 21 to day 100, there is a copay per day. So there are some gaps. And then under Part B, you pay that $134 monthly, and then you have $183 annual deductible. After you pay that annual deductible, when you go see the doctor for the first time that year, then you will only have to pay 20%, and Medicare will pick up 80%. But those are still gaps that people will want to fill in. So they might pick up a Medicare Advantage plan, like an HMO or a PPO. Those plans have the drug coverage embedded right in them. And in this service area, we have a couple that are available. We've got plans through Health New England and Blue Cross and Tufts. But you want to make sure that the providers that you use are in those plans. So it's important if you go that route. And that's not the only route that you can go. You could also go and pick up a Medigap policy and a Part D, a standalone Part D drug plan. And the Medigap policies are really good for people that do a lot of traveling, that like to go in and out of the state for coverage, or prefer to go to doctors that might be, 4 towns over, or even in another state. So you can go to any doctor, any hospital, anywhere with a Medigap supplemental plan. And we have 2 kinds of plans in Massachusetts. A core plan that doesn't cover all the gaps. It doesn't cover the Medicare deductible, and it also doesn't cover the hospital deductible or the days 21 to days 100 in a skilled nursing facility. But the Supplement 1 pretty much covers everything that is not covered. So, and you might have heard of, different plans that do that. They're all the same players: Health New England, Blue Cross Blue Shield, Tufts, Harvard Pilgrim. They all have supplemental plans in Massachusetts, and these plans coordinate with
And
Medicare.
these are the supplementals of the Medigap.
Yes, and the supplemental plans, once Medicare pays, then they send the bill to the Medigap plan, and then the Medigap plan pays. So it works out fairly well. You don't have to worry about that.
Goes Medicare pays first, then supplemental?
Mm-hmm.
Okay, I always thought everyone had to pay first before Medicare.
No, Medicare.
That's Medicaid.
Yeah,
Okay.
yeah, oh yeah.
Okay.
Medicaid in our
Yeah.
state is Masshealth, and they're always the payer of last
Medicare
resort.
Advantage.
So Medicare is your primary coverage when you turn 65.
Yeah.
So those are
And
some
these
of the
companies
options
offer
that a
this,
person
yeah.
has. If they go with a Medigap plan, though, they do need to pick up a standalone drug plan. And that's really why we're here today, is to talk about those standalone drug plans and the Medicare Advantage plans with drug coverage, and how important it is to really review the information that's sent to you, to go over and make sure that your medications are covered by that plan, and that you're okay with the premium, and if there's any restrictions. And Jane or I or any Shine counselor could help you. We have counselors in many areas in this service area, and we could figure out for you what would be the lowest costing plan if that was most important to you, or what was the highest star rated plan. There's a lot of ways that we can search. Some people, in general, these plans, what they do is you pay a premium, then there's a deductible for the plan, so you pay the first amount of money towards your drugs, and then after that you pay a tiered copay. And then there's also a coverage gap, an area where there's not as much coverage as there is in the initial coverage period, so you'd be responsible to pay more. And we know about all sorts of special programs that can help you with those out-of-pocket costs once you get to the coverage gap. One of them is called the low-income subsidy, which is administered through Social Security, and there's more information on the pink sheet about that. And the other one is called Prescription Advantage, which is a state prescription assistance program, and what that does is it helps pay during the coverage gap. And it is, you have to be financially eligible, but the eligibility level is really high for seniors, and there's no asset limit, so that's always helpful too. Because a lot of the programs that we screen people for, there's income and asset limits, and we want to make sure that we screen every person. But then there's a couple programs that have higher incomes and higher assets, and it can be very helpful. So,
So if we were looking at the two of us, whereas I have income and she doesn't, is that based on her income or our couple income?
when you're married, your income is her income and her income is your
It's
income.
always been, so.
Yeah. And
Hers
that's
is hers and yours is hers.
That's it, right.
So they look at the combined
Okay.
amount. They're never gonna separate you.
Okay.
Yeah, they don't do that in general, that doesn't happen. But there are some special Medicaid programs that work like that, and there may be some other programs, but the person has to be really frail in order for them to waive their spouse's income.
Okay, thank you.
So, yeah. So I'm just gonna look over, make sure that I reviewed all of that information, and just to make sure that I've gotten everything. Oh, no, that didn't happen this year. Sometimes people get reassigned to different drug plans because the plan they're in has changed. And I think that did not happen for anyone this year. If you want to make a change and you're not able to meet with a Shine counselor, you also can go onto the computer at medicare.gov and go to the plan finder, and you're able to put your information in about the drugs that you take, and you can try doing it yourself, not a problem. If you need help, you can also call Medicare at their number, which is 1-800-633-4227. Again, use that word agent, and you can contact them and they can help you. They are not as good as the SHIP program, which is the Shine program in Massachusetts, because they don't really know all the specifics about our service area, but they have the ability to research the information and tell you what is available in your service area. But they're from, they could be anywhere. They could be in Delaware, they could be in Maryland. We don't know exactly where they're located. So sometimes it's better not to use them, but you can use them. You can also contact your local Shine program. And I do know that the Medicare Advantage plans, some of them are having, seminars in the service area. And I think you had Blue Cross here recently.
Health New England's coming.
Health
New
New England's coming in November.
In November.
Yeah.
Yeah, so
Blue
they.
Cross was yesterday at Hadley Farms.
Oh, right,
meeting
that's
house.
right. Yeah, because I saw one of their outreach people, Heather Hurd.
So
And
she's
she
very
said
good.
Yeah, she said she was gonna be in Hadley. So I thought it was here for some reason.
You know if Tufts is gonna be in the area?
I don't think so. I don't think they have any, but you can call them directly. Now, if somebody was considering Tufts Medicare Advantage plans with the HMOs that they have, the one thing that you would want to consider is, one, you want to make sure that your doctors are all on board with the Tufts Medicare Advantage plan. And we also know that the only hospital that Tufts has right in this service area is Cooley Dickinson. So if you wanted to use Cooley Dickinson as your hospital, that would be great, but they don't have a contract with Bay State. Unless it was an emergency visit and they were the closest hospital, it would cover under those circumstances.
Health New England is all Bay State.
And Health New England is all Bay State. Blue Cross Blue Shield, their HMOs and PPOs have a bigger network because they've been around longer.
Yeah.
Health New England's network is a great network. They pretty much cover all of Western Mass. They have all the doctors, all the hospitals, the skilled nursing facilities, and then they also offer services through their Hartford County hospitals and doctors in Connecticut. But they don't have anything east. So outside Western Mass, there's really no coverage under their HMOs and HMOs.
Unless you get a referral.
Unless you get a referral, but it would be.
If it can't be done here.
Yeah. It would be only under the circumstances that there was no specialist available to manage your care in this service
And
area.
that's under which? Under
Health New England.
Under health.
They're all good plans. They, Tufts has a 5-star rating this year. They don't have as many providers in our service area, and the 5-star rating just means that they've gotten the best results either through the members and providers, so they have a good reputation. But Health New England and Blue Cross Blue Shield are also 4-star plans, or 4.5-star plans, so they've done very well as well. Yes, ma'am?
We have Health New England. When we were in Pennsylvania with grandchildren, he had an emergency and they covered every scrap of it. He didn't have to pay anything.
Exactly. So anybody that has a Health New England or one of these kind of Medicare Advantage plans like an HMO or a PPO, they're going to be able to get the service they need if it's an emergent or urgent care situation. It's just that if you say you went down to Florida and you had this kind of a plan and you went to the podiatrist to get some footwork done, you wouldn't be able to have that done because that is outside of the realm of urgent and emergency care. So they cover you anywhere as long as it's urgent or emergent. Say you're a person that lived in Arizona 6 months out of the year, and you were here 6 months out of the year, and you called this your residence, and you probably wouldn't want, one of those HMOs, because if you had anything going on, you would really have your care here. You'd want to get a Medigap policy, or stay with original Medicare A and B only, where you would have out-of-pocket costs and a few gaps. But a lot of people, if they are snowbirds or if they travel a lot, even out of the country, they might pick up one of these Medigap supplemental plans to cover them in and out of the country, in and out of whatever state they're in. And it can be very helpful. But the one thing about the Medigap policies, they do not cover any drugs, so you have to pick up a standalone Part D drug plan. And these drug plans, if you don't pick them up when you become eligible for them, which is when you lose your drug coverage initially, or you're turning 65, or you lose your employer drug coverage, you only have a 2-month window to pick up a drug plan. And they also have a penalty associated with a delayed enrollment where you don't have coverage. So their penalty is not quite as high as the 10% penalty for Part B, but it can be because it's continuous. So if you never enroll in a drug plan, you'll never have a penalty. But if you enroll in a drug plan late and you had drug coverage, they're going to go back to when you turned 65 or lost your drug coverage, and they're going to penalize you 1% for every month that passed that you could have had coverage that didn't, on a scale of what the average amount of money for these plans are. So the average amount of money for a premium for one of these drug plans is anywhere from $14.60 to over $100. And this year, a month, yep. And this year it's $35.08, which is the average cost. So if the penalty was based on 1% of that, it would be 35 cents for every month that passed. I worked with somebody recently, and just a few days ago, and they took one medication. They never got a Part D drug plan, and they picked up a plan that their medication would only be $3, and they've been paying about $40 for that med each month. Their penalty is going to be $25 because they hadn't gotten a Part D drug plan or any drug coverage for 5 years. So it still was beneficial to her, even though 5 years had passed, and her penalty was going to be for 60 months at $35 for her to pick up that plan rather than pay for it separately. So it's sort of interesting. At some point, there's a math equation about, does it make sense for me to get this? And we don't have, a crystal ball to tell us, are we going to be sick? Or do we need this coverage? It's can be very difficult. So a lot of people, when they're choosing their insurance, they're choosing insurance that they are hoping they wouldn't need, but just in case they have it. And you have to base your insurance on what your needs are. And sometimes Jane or I or other Shine counselors will ask you when we're meeting with you, were you in the hospital in the past year? Do you go to the emergency room frequently? Or if you have chronic illness, that might make a difference, because Medigap Plans is a route where people go and they pick up a supplemental insurance that works with Medicare. If they're going to the hospital and doctors a lot, they could have picked up a plan that they don't have to pay anything at the doctors, at the hospital, at a nursing home. They have no out-of-pocket cost except for their Part D drug plan. They pay a higher monthly premium, but to them it's worth it because they've been in the hospital. Say you had, trying to think of the name of that, osteoporosis, and you bend over and you fracture your back, or somebody that might have frequent fractures, or say they have cardiopulmonary disease and they get a lot of lung things, so they're at specialist doctors' offices and the emergency room frequently. The kind of plan that might be better for them would be a Medigap plan, but if somebody, say their spouse, never in the hospital, they see the doctor once a year, they don't take any medications, they may not need that kind of a plan. A Medicare Advantage plan might be perfect for them, and they get a little extra benefits with one of the Medicare Advantage plans, like you get a little help with glasses, maybe a little help with dental, not much, but a little extra, and that appeals to them. So it could be that a couple comes to us, one of the couple needs one thing and the other one needs a different kind of a plan. So a person doesn't have to go with the same plan. And it really is individualized, yes.
So the Medigap plans, what's the range of costs for those? Medigap?
Yeah, so those plans, the core range is about $100 a month, and the supplement one plans are about $200 a month. And then you would have to add your Part D drug plan onto it, and you'd still have to pay your Part B premium, so it can be quite costly. One thing about Medigap plans, if you're getting them when you first get your Part B, so you're just becoming eligible for Part B and you pick them up, they do have a discount program where you might get 15% the first year, 10% the second year, 5% the third year. But it's dependent on, when you turn 65 or when you initially became eligible for Part B of Medicare.
Because it's not for people, let's say like this couple here who she's 66 and now going on to a Medigap plan, she wouldn't be part of that discount because she didn't get it when she was 65.
No, you can get it through a special enrollment. So if
For
she
the
has
Medigap
Part B
plan?
already,
Yeah.
if she has Part B already, she can't get it because she's 66.
Right.
But say she deferred, she delayed her Part B because she was covered under her spouse. And she didn't really have to pick up Part B because she's had active coverage through her spouse's employment. Then she picks up Part B because she's no longer covered under his or her plan. At that time, she is new to Part B of Medicare, and she can get the discount at that time. Now, if you were under 65, they do not give you the discount when you become eligible for Medicare, and that would be for somebody that might be disabled under 65. After they collect Social Security for 24 months, on the 25th month, they become eligible for Medicare. So, and now, is your situation that you have a Medigap policy and a standalone drug plan? You have one of those Medicare Advantage plans? Yeah. Yeah, so the plan that you have is through Health New England. There weren't a lot of changes. One of the changes I know with Health New England that was probably one of the biggest deals is that they used to not charge for Part B medications, and now there is a charge for that.
I've always had a copay for medication,
Yes, always a copay.
but we don't have, an amount that we have to pay. What do
A
we call it?
deductible?
A
Deductible.
deductible, we don't have a
Right.
deductible. It
Oh,
goes
that's
into
good.
that.
Just copay.
But
Great.
there are definitely different levels of, how much you have to pay for copay.
Yeah. I do have the materials with me. If you're interested, we can give them to you after as well. Any specific questions that you have?
Are you gonna address the different, separate RX plans, prescription plans?
Not really, no. I don't usually go through each and every one of them. I mean, they all have changed a little bit. I think I can tell you a couple things about them. You know, the prices are always going up and down. So I know, you know, for instance, the blue Medicare RX standalone drug plans have both gone down this year. And a lot of the plans, these standalone drug plans, have initiated something called preferred pharmacies. And with preferred pharmacies, if you use the pharmacy that is preferred, you can usually get a better deal at that pharmacy on your medications. For instance, you know, if you got one of the plans that had CVS or Walmart as their preferred pharmacy, your generics might not cost very much at those preferred pharmacies. If you just used a regular network pharmacy, that's a pharmacy that you can go to, no problem with your plan, but you're not going to pay the least amount for those drugs. And a lot of these plans, and something to really look at nowadays, is that these plans have benefits for people. So in general, there's a deductible for these plans. The highest deductible that a person can have is $405. So after they pay the deductible, and you said you don't have a deductible on your Medicare Advantage plan, after you pay the deductible, then you pay a copay, and that copay usually is about 25% of the cost of the medication, and Medicare picks up 75% of the cost. And they're tiered copays based on the medication. So tier 1 and tier 2, that's generic and preferred generic and non-preferred generic. A lot of these plans lately, what we've seen is that they waive the deductible, so you don't have to pay the deductible for those drugs that are in tiers 1 and tiers 2. And that's a good thing, because if you only take generic drugs, then you don't have to worry about the deductible. Now, we never know when we're going to be given a brand name medication, and that could come into play. But a lot of these plans, if you took a lot of generic drugs, you should really research, you know, if the plan does that, because some of them are doing it now, a lot of them are doing it. And so the preferred pharmacy has become a really important issue. And I brought some stuff for Jane today just to show her that we have a list of the preferred pharmacies with each drug plan.
So I was curious, do the different insurers decide which drugs, whether they're generic or non-generic, go into which tiers?
Yeah, because they can vary by,
Yeah.
by company. Yeah.
They could be percentages, they could be tiers. In general, this is how it works. You've got your preferred generic is tier 1, non-preferred generic is tier 2. Tier 3 is usually a preferred brand name, tier 4 is non-preferred brand name, and tier 5 is specialty drugs, which might be cancer drugs, they could be injectables. They're usually the most expensive medications. Like, has anybody heard of the medication Advair Discus? It's an inhaler. Lots of times that's a 5 or a 4. But sometimes they work by percentages. So it could be that you've got tier 1 through 4, and then tier 5 is a percentage. It's not a actual amount. It's like 50% of the copay. Now these plans in 2018 are going to cover up to $3,750. And at that point, that's when you go into the coverage gap. And in our state, I told you, we've got, you know, a couple different programs that help pay the cost during that coverage gap. And then after the total amount of what you paid reaches $5,000, then you go into the catastrophic benefit, where you're going to pay about 5% of the cost of your medications. A lot of us don't go that high. We don't have, our medications aren't that expensive. But if you have expensive medications, there are special programs out there that can help them. So what I'd like to do is just take a few minutes to go over this pink sheet that talks about some special programs that are out there. These programs might not help you, but you might know somebody that they can help. So I'm going to look to you to pass this information on to others, because I think it can be very helpful. So for a person that is over 65, for the state's Medicaid program, a person would have to have an income of $1,025 or less. And their assets would have to be below $2,000. Now that would not include a house, your house that you live in, or your car that you drive. It wouldn't count those things. If you were a couple, then your income could be a little higher. It would be at $1,374, and your assets could be a little higher at $3,000. Now those incomes are pretty low. If you have an income that low, you should be getting this benefit where Masshealth, our state's Medicaid program, would be paying the out-of-pocket costs for you when you go to the doctors and to the hospital, and you wouldn't really need to purchase additional insurance. You could use this program for your insurance. So it's an important piece to look at, and they're going to include, what you get from Social Security, and if you get a pension and so forth. So all of that adds up. Now, if a person has that eligibility, they also get their Part B premium paid for, so they get that $134 back in their Social Security check.
Excuse me,
Yes.
does that income thing, does that also include how much you have in your bank account, or if you have any investment?
Yeah, so when you look at assets, it counts anything that's liquidable. A question that I get often from people is, so I can't touch the money I have in my IRA because I'll have to pay a penalty. But that doesn't mean you can't touch it. It means it can be liquidated and they're gonna count it, yeah, it's countable. So even if you have a penalty, it's still countable because you actually can liquidate it, so they do count it. But once that's gone, if you use that money, you live to 200.
God forbid.
No, I'm kidding. But, the longer people live, we utilize more of the money that we put away to survive. So, a lot of people spend down to this amount. I mean, I don't know about your Social Security, but my Social Security is not that high, and it's not that it's awful, but it's not gonna be great. If I didn't have something else, then there's programs out there that you might be eligible for. And I wouldn't be eligible because I had a little IRA or something, but once that was gone, maybe I would. So the other programs that we at Shine like to make sure people know about are something called the Masshealth Senior Buy-In Program. This has a couple different names. It's also called the Medicare Savings Program. Basically, these programs help people pay the out-of-pocket costs for their Medicare Part B. And you could have an income as high as $1,847 a month as a couple, or $1,377 as an individual. And the asset limit for a couple is $11,000, so you have a little higher asset limit for a couple, and then for an individual it's $7,390. Now the benefit to having one of these programs is that not only does it pay your Part B premium, but it also pays your drug premium, and it lowers your out-of-pocket costs with your co-pays for your medications. So it's a real win-win situation, and I think for me, it's great intrinsic value to help somebody if they're eligible for this program, because you're gonna change their life. They're gonna have more money to live on and do the things that they wanna do and not have to pay for these things. So that can be very helpful.
So would somebody have to sign up for this during the enrollment period, or? do they-
Anytime. This can happen anytime. I just don't like to go anywhere and present without talking about some of these great programs that are out there. So you can enroll in these anytime. It's not particular to the annual open enrollment period of Medicare for these drug plans. And then there's Extra Help, and that's a program, it's also called the Low Income Subsidy. It's administered through Social Security. And again, this has an even higher income limit. It goes up to 150% federal poverty level. So it's $2,050 for a couple, or for an individual, $1,528. And the income limit is higher for a couple. It's at $27,600 or $13,820 for an individual. So if you had income and assets below this, then you would be eligible to have your Part D drug plan paid for, and you'd have reduced out-of-pocket costs for your medications. So that can be very helpful. And then the other program I've already talked a little bit about, which is Prescription Advantage, which is good for people that have higher incomes. The income can be as high as $4,060 for a couple, or $3,015 for an individual, and there's no asset limit, and that's a monthly figure. So it's really quite high, and that is a very helpful program for people who go into the coverage gap where they have very expensive medications and they need help. Now, right now, we have the Affordable Care Act, and the Affordable Care Act helps pay for out-of-pocket costs towards a percentage of these drugs, whether they're brand or generic. If that goes away, that would not be good. We don't know really what's going to happen with the Affordable Care Act at this point as far as this is concerned. They've talked about keeping this piece, but we really don't know yet. But the point is that there are programs out there that can help you if you go into that coverage gap, and you should seek assistance. And Prescription Advantage, the information is on this yellow card if you want to contact them directly, or it's on the pink paper actually. And it really is helpful if you have that program and you go into the coverage gap, because it can really make a difference in how much you pay for medications. So, did we cover everything, Jane?
I think pretty much, yeah.
Okay, so just a few more things. If anybody needs a Medicare and You 2018 book, we also have some beautiful Medicare calendars free of charge to you, and they are just lovely, of different bridges in the United States. And then this is a good informational about the Medicare, your Medicare cards, and just on fraud, and it might be helpful for you, especially people that are new to Medicare. And just one more thing, which is that you will be getting new Medicare cards starting in March of next year through March of the following year. They're going to be taking your Social Security numbers off those cards. So the card is a little bit smaller. It's still going to be paper, and it's it will be, you can put plastic on it if you want to, but those will be coming to you, all of next year. Different people will be getting them at different times. Any questions?
So you'll have a new code to remember with a new card, huh?
If you like to remember those codes, yes. But it won't be as dangerous because it won't have your Social Security number on it. Yeah, but you'll have to bring that to your doctor's office when you get it.
Well,
And to
I
shine
never-
if you come.
I never
Yes.
take my Social Security card anywhere. I mean, I have my Health New England Advantage card, and that's what I use. So, I mean, my Social Security card is.
No, but your
buried somewhere.
Medicare card, your regular Medicare card has your Social Security
Right,
number
but I
on it.
don't ever take
Right,
it.
'cause you have
I think
to
she
take
meant her
it.
Medicare
Yeah.
card, yeah.
But
Yeah.
I mean, the Health New England is
Mhm.
all I ever take to my doctor.
Right.
Yeah.
Right.
Well, you don't have original Medicare when you have a replacement plan, like a Medicare Advantage plan, like Health New England.
Oh.
So you would only want to have that card, because you would confuse your provider if you gave them both of them. You sort of put the Medicare card away.
Confuse me.
Other questions?
One other one.
Sure.
So I'm trying to enroll my husband, and we're looking, and I'm thinking I'm gonna go with a Blue Cross Blue Shield PPO, only because he has Advantage plan. Because he has a provider in, that's at Cheshire Medical, because he used to live in Brattleboro, for his thyroid that's being monitored. And I know Health New England's pretty strict about in-service doctors only. And that's why I started
They'd
looking.
want him to see a different endocrinologist,
Really?
endocrinologist. I think that's the word, isn't it?
Mhm.
For thyroid?
He's actually an ear, nose, and throat guy, I think, but he does surgery and
Oh, okay.
most of that stuff. But, so does that sound logical to you, that the PPO would let him continue to see that doctor?
Yes, but I would call just to make sure that it's fine.
And what happens is if you look at the plans with the PPO, some of them can act as an HMO or a PPO, And
Right.
if you go in-network, you have a cheaper copay. If you go
Yes, that's
out-of-network,
what
it's
this
more
is.
expensive.
It was like
Yeah.
15 and 20.
Right.
That's one of
Yeah.
them, and some of their PPOs are exactly the same in and out of network. The Value Plus RX
The
actually is.
$200 a month one.
It's gonna be $76 next month.
That's the one I was looking at.
Mm-hmm, yep. Not saying that this plan is good over any other plan.
No.
It's really to individual
Well, it just kind of,
needs. Yeah.
swayed me away from Health New England a little bit, knowing
Mhm.
that. And so, I mean,
It's a very personal decision.
Yeah,
For
it
sure,
is.
for sure.
it is.
Yeah, our friends were with Health New England, but they switched to Blue Cross because they're out of the state so often.
Yeah.
So just to be able to have coverage out of state better.
So they went to a supplemental Medigap policy.
I'm not sure if it's Medigap or not.
They went Blue Cross
It's
Blue
Blue Cross
Shield.
Blue Shield, but that's offered through
Both
Blue Cross.
kinds of plans. So the same players in different insurance companies have different products. So Health New England, Blue Cross, Blue Shield, Tufts, Harvard Pilgrim, United Healthcare, they all have programs that are Medicare Advantage plans, and they have Medigap supplemental plans. So they have different products. So it gets confusing. So when you're calling your doctor to see if they accept a particular provider, we always tell people to call the billing department and make sure that you tell them it's a Medicare Advantage plan or it's a Medicare supplemental plan. But basically, if your doctor has a contract with Medicare, you don't have to worry about the supplemental plans, they're going to take them.
So my understanding is that the government controls the kinds of plans that can be offered, whether they're supplemental or advantage plans. And then the different insurers, basically the difference between insurers is what they're charging for the plans and what little extras they may be throwing in there to entice you to take them to take Health New England, say, as opposed to Blue Cross Blue Shield. But basically, there's two flavors of the supplemental or Medigap plans. And there's the HMO and PPOs on the Advantage side. But again, whatever your doctors are and whatever your prescriptions are, you gotta see what fits for you, what works for you.
I think basically that's true. The Massachusetts Division of Insurance mandates and regulates the Medigap supplemental plans, and the Centers for Medicare and Medicaid really manage the Medicare Advantage plans and the standalone Part D drug plans about the prices and such. And there's a lot of regulations. These plans can't go up only a certain amount of money, or they have to appeal it through legislation or, go to court for that. And under the Medicare Part D plans, it's the same way. They have to prove that they're, utilizing the amount of services to go with an increase. Okay? All right, well, thank you.
so much.
Thank
You're
you.
welcome, thank you.
The maze, the Medicare maze.
Yes. I hope it was helpful. Do you know more than you did when you got here?
Yes. Yes.
How do you ever figure it